I'm Dr. David Beaulieu, and I'm back with more news you can use. And I'm back again today with Dr. Susan Anschutz, who handles the chiropractic division of the Essential Care Centers in the greater Kansas City area. And she also runs the Hyperbaric Oxygen Center. And I wanted to talk to you a little bit about that today, because there's an enormous emphasis in our centers on brain disorder. Medicine likes to label things: paranoia, dementia, autistic spectrum disorder, anxiety, depression. Dementias are extremely high on the list now because Alzheimer's become the #3 killer behind cancer and heart disease. So it's in the news, and medicine doesn't have much for that. And we do. The brain is 60 to 70% fat. A moderate to high fat diet is critical if the brain's going to heal and replace itself. But the brain has to have energy. It must have oxygen to make energy and heal. And Dr. Anschutz has the only chiropractic hyperbaric oxygen facility that I know of in the greater Kansas City area. Dr. Anschutz, tell us a little bit about hyperbaric oxygen and brain disorder.
Well, a lot of brain disorders happen because there's low metabolic activity in the brain. There's not much going on. And when they do imaging, for instance, of kids on the autistic spectrum, they often find out that the temporal lobes, which are in charge of sensory issues, hearing, are low in metabolic activity. So they put them in the hyperbaric chamber, and the largest study, controlled study that's been done, was using the exact type of chamber that I have at the same pressure and the same oxygen concentration. And they found that the kids improved functions both by their parents' accounts and by the doctor's testing. So we see when that temporal lobe gets going, they become less sensitive to things like noises and touch and how things feel. They get better fine motor skills. They get better verbal skills. Their vocabulary just explodes sometimes. They get better at controlling those urges. Instead of going straight into a reaction, they seem to be able to take that moment and stop and say, is this the proper reaction to go into maybe here at the grocery store? Or should I do something else? And it puts that brake on it. It's safe. It's easy. The kids love getting in there, snuggling with the parents for an hour, and very effective.
I think that sums it up.